Okay, so this is Chapter 1 of the Mental Health ATI, Basic Mental Health Nursing Concepts. Provision of care to clients in mental health settings is based on standards of care set by the American Nurses Association, the American Psychiatric Nurses Association, and the International Society of Psychiatric Mental Health Nurses. Nurses working in mental health settings should use the nursing process as well as holistic approach, biological, social, psychological, and spiritual aspects to care for clients. Nurses should use various methods to assess clients. These methods include observation, interviewing, physical examination, and collaboration. Assessment. Perform a physical assessment as indicated for client condition or policy. Use touch to communicate caring as appropriate. However, respect the client's personal space if they do not wish to be touched. Be sure to include questions relating to difficulty sleeping, incontinence, falls or other injuries, depression, dizziness, and loss of energy. Include the family and insignificant others as appropriate. Obtain a detailed medication history. Following the interview, summarize and ask for feedback from the client. Each encounter with the client involves an ongoing assessment. Psychosocial history. Assess the client's perception of own health and beliefs about illness and wellness. Assess activities, leisure activities, how the client passes time. Assess the client's use of substances and any other history of a substance use disorder. Assess the client's stress level and coping abilities, usual coping strategies, support systems. Cultural beliefs and practices. Assess the client's cultural health care beliefs, practices, and values. Assess for cultural factors that can impact the client's care. For example, does the client's diet consist of cultural-specific foods? Does the client have specific beliefs or practices regarding health care? How is the client's diagnosis viewed in their culture? The nurse's awareness of culture alleviates stereotyping and stigmatizing. Use a trained interpreter when needed. Spiritual and religious beliefs. Spiritual and religious beliefs affect the way in which a client finds meaning, hope, purpose, and a sense of peace. Spirituality refers to a client's internal values, sense of morality, and how the client views the purpose of life. The client might not connect these spiritual views with religion. Religion refers to a client's beliefs according to an organized set of patterns of worship and rituals. Assess the client support system and assist the client to identify support persons and resources. Assist in locating a spiritual or religious leader if needed. Mental status examination, or MSE, level of consciousness. The level of consciousness is described using the following terms. Observed behaviors are included in the documentation. Alert. The client is responsive and able to fully respond by opening their eyes and responding to a normal tone of voice and speech. The client answers questions spontaneously and appropriately. Lethargic. The client is able to open their eyes and respond but is drowsy and falls asleep readily. Stuporous. The client requires vigorous or painful stimuli, pinching a tendon or rubbing the sternum, to elicit a brief response. The client might not be able to respond verbally. Comatose. The client is unconscious and does not respond to painful stimuli. Abnormal posturing in the client who is comatose. Decorticate, rigidity. Flexion and internal rotation of upper extremity, joints, and legs, and decebrate, rigidity. Neck and elbow extension, wrist and finger flexion. Physical appearance. Examination includes assessment of personal hygiene, grooming, nutritional status, clothing choice, and whether the client looks older than the stated age. Expected findings with regard to the assessment are that the client is well kept, clean, and dressed appropriately for the given environment. Behavior. Examination includes assessment of voluntary and involuntary body movements and eye contact. Mood. A client's mood provides information about the emotion that the client is feeling. Affect. The client's affect is an objective expression of mood, a flat affect or a lack of facial expression. Cognitive and intellectual abilities. Assess the client's orientation of time, person, and place. Assess the client's memory, both recent and remote. Immediate. Ask the client to repeat a series of numbers or a list of objects. Recent. Ask the client to recall recent events, visitors from the current day, or the purpose of the current mental health appointment or admission. Remote. Ask the client to state a fact from their past that is verifiable, their birthday or their mother's maiden name. Assess the client's level of knowledge. For example, ask the client what they know about their current illness or hospitalization. Assess the client's ability to calculate. For example, can the client count backwards from 100 and serials of 7? Assess the client's ability to think abstractly. For example, can the client explain the similarities between two objects? How are cars and trains similar? The ability to explain this demonstrates a higher level thought process. Be sensitive to cultural or primary language differences. Perform an objective assessment of the client's perception of his illness. Assess the client's judgment based on the client's answer to a hypothetical question. For example, how would they answer the question, "What would you do if there were a fire in your room?" The client should provide a logical response. Assess the client's rate and volume of speech, as well as the quality of their language. The client's speech and responses should be meaningful, articulate, and appropriate. Standardized screening tools. There are a number of standardized rating scales that can be used for evaluation and monitoring for clients. Adverse Childhood Experiences Questionnaire, Brief Patient Health Questionnaire, Brief PHO or PHQ, and the Mini Mental Status Exam or MMSE. The examination is used to objectively assess a client's cognitive status by evaluating the following: orientation to time and place, attention span and ability to calculate by counting backwards by 7, registration and recalling of objects, language including naming of objects, following of commands, and ability to write. Pain assessment. Pain rating tools include visual analog scales, Wong-Baker's FACES Pain Rating Scale, the FACES Pain Scale Revised, the McGill Pain Questionnaire, MPQ, and the Pain Assessment in Advanced Dementia, which is PAIN-AD scale. Considerations across the lifespan, children and adolescents. Assessments include temperament, social and environmental factors, cultural and religious concerns, and developmental level. The client should be the source of the information, but the children and adolescents caregivers can also provide valuable information. Mentally healthy children and adolescents trust others, view of the world as safe, accurately interpret their environments, master developmental skills, tasks, and use appropriate coping skills. Children and adolescents experience some of the same mental health problems as adults. Mental health and development disorders are not always easily diagnosed, potentially resulting in delayed or inadequate treatment interventions. Factors contributing to this include the following: lack of the ability or necessary skills to describe what is happening, and a wide variation of normal behavior, especially in different developmental stages. Assess for mood, anxiety, development, behavioral and eating disorders, and risk for self-injury or suicide. Use the HEADS standardized assessment tool. Home environment. What is the client's relationship like when their guardian and other family members living in the home? Education and employment. Is the client employed? How is the client's school performance? Activities. Does the client participate in sports or other activities? How does the client interact with peers? Drug and substance use. Does the client use substances, alcohol, tobacco, or illicit drugs? Sexuality. Has the client engaged in any sexual activity or had any sexual encounters? Suicide and depression. Is the client at risk for suicide or self-injury? Does the client have indications of depression? And safety. Is the client exposed to abuse in the home or violence in the neighborhood? Older adults. In addition to the aforementioned assessments, a comprehensive assessment of the older adult client includes the following: functional ability, the ability to independently get dressed or manage household tasks; economic and social status; environmental factors, stairways in the home that can affect the client's well-being and lifestyle. Standardized assessment tools that are appropriate for the older adult population include the following: geriatric depression scale, short term; Michigan Alcoholism Screening Test, which is geriatric version, and the MMSE. Conduct an assessment of all clients in the following manner. Use a private, quiet space with adequate lighting to accommodate for impaired vision and hearing. Make an introduction and determine the client's name and pronoun preference. Stand or sit at the client's level to conduct the interview, rather than standing over a client who is lying in bed or sitting in a chair. Social determinants of mental health are the ways clients live and work and how those shape their health outcome. These can be rooted in health inequalities. Disparities in mental health care, treatment, and accessibility profoundly influence the outcomes and experiences of clients. Understanding disparities in mental health care requires consideration of the SDOMH, which have been identified by the World Health Organization. Although not fundamentally different from the social determinants of health, SDOH, as they are linked to health, mental health experts understand that the solutions for mental health may require a different approach. Trauma-informed care. Nurses are sensitive to the importance of screening for interpersonal violence and trauma to better understand current client behaviors and relationships. Realize that trauma can affect people and groups. Recognize the signs of trauma. Organize response to trauma and resisting re-traumatization. Mental health diagnosis. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, published by the American Society, is used by mental health professionals to diagnose mental health disorders and clients following standard criteria. It includes expected assessment findings for disorders and helps with planning, implementing, and evaluating care. Nurses use diagnosis from the North American Nursing Diagnosis Association, or NANDA, to provide the basis of appropriate nursing interventions for clients. Serious mental illness includes disorders classified as severe and persistent mental illnesses. Clients often have difficulty with activities of daily livings, or ADLs, are lifelong disorders that can have remissions and exacerbations. Role and life changes. Role transitions include loss of employment, divorce, retirement, grandparenthood, widowhood, death of guardian, and becoming a caregiver or recipient of care. Some role changes are predicted in upcoming retirement. However, the client might find that others are unexpected, becoming the recipient of care due to a sudden illness or injury. Assessing the client's ability to adapt and cope includes the following: health status and functional abilities, living arrangements, employability, personality factors such as attitudes, client caregiver and family assessments, level of information such as community programs, medication use and supplemental services. Evaluating whether client has successfully adapted includes the following: able to state positive coping behaviors, able to identify maladaptive coping behaviors, able to participate in community resources, able to list stress reduction techniques, able to maintain housing and employment. Therapeutic strategies in the mental health setting. Counseling, using therapeutic communication skills, assisting with problem solving, crisis intervention, and stress management. Milieu therapy, orienting the client to the physical setting, identifying rules and boundaries of the setting, ensuring a safe environment for the client, and assisting the client to participate in appropriate activities. Screening, trauma history, risk for suicide and non-suicidal self-injury, substance use, coping skills, and support systems. Promotion of self-care activities, offering assistance with self-care tasks, allowing time for client to complete self-care tasks, setting incentives to promote client self-care. Psychobiological interventions, administering prescribed medications, providing teaching to the client and family about medications, monitoring for adverse effects and effectiveness of pharmacological therapy. Cognitive and behavioral therapies, modeling, operant conditioning, systemic desensitization, health screening, teaching social and coping skills, health promotion and health maintenance, assisting the client with cessation of smoking, monitoring other health conditions, and case management, coordinating holistic care to include medical, mental health, and social services. A nurse is an outpatient mental care health clinic is preparing to conduct an initial client interview. When conducting the interview, which of the following actions should the nurse identify as the priority? Identify the client's perception of their mental health status. A charge nurse is discussing mental status examinations to a newly licensed nurse. Which of the following statements by the newly licensed nurse indicates an understanding to the teaching? A, B, C. To assess cognitive ability, I should ask the client to count backwards by sevens. To assess affect, I should observe the client's facial expressions. And to assess language ability, I should instruct the client to write a sentence. A nurse is planning care for a client who has a mental health disorder. Which of the following actions should a nurse include in a psychobiological intervention? Monitor the client for adverse effects of medication.